What is status epilepticus? Status epilepticus is a medical condition consisting of a single seizure lasting more than 5 minutes, or 2 or more seizures within a 5-minute period without the person returning to normal between them. The seizures can be of the tonic-clonic type, with a regular pattern of contraction and extension of the arms and legs, or of types that do not involve contractions, such as absence seizures or complex partial seizures. Benzodiazepines are the preferred initial treatment for status epilepticus, after which typically phenytoin is given. Possible benzodiazepines include intravenous lorazepam, as well as intramuscular injections of midazolam. A number of other medications may be used if these are not effective, such as phenobarbital, propofol, or ketamine. After initial treatment with benzodiazepines, typical anti-seizure drugs should be given, including valproic acid valproate, fosphenytoin, and levetiracetam. A 5-year-old boy is brought to the emergency department due to recurrent, generalized tonic-clonic seizures over the past 24 hours. The patient has been having high fever and flu-like symptoms for the past 3 days. He has a past medical history of febrile seizures at age 6 months. He takes no medications and has no family history of epilepsy. The patient's temperature is 39.4 degrees, blood pressure is 110/70, pulse is 112, and respirations are 10 per minute. He appears lethargic and does not follow simple commands consistently. His neck is supple. During the examination, the patient suddenly develops sustained, generalized tonic-clonic convulsions without fully regaining consciousness between episodes. Which of the following describes the mechanism of action of the most appropriate initial therapy for his seizures? The correct answer is C. Enhanced postsynaptic chloride influx. This patient has status epilepticus, possibly due to complex febrile seizures or infectious meningitis encephalitis. Regardless of etiology, the initial drug of choice for treating status epilepticus is an intravenous benzodiazepine, for example, lorazepam, due to its efficacy and rapid onset of action. Benzodiazepines enhance the effect of the inhibitory neurotransmitter gamma-aminobutyric acid GABA at the GABA-A receptor, a ligand-gated ion channel. Allosteric attachment of benzodiazepines to the GABA-A receptor causes increased influx of negatively charged chloride ions in response to GABA binding. This leads to hyperpolarization of the postsynaptic neuron and suppression of action potential firing anticonvulsant effect. Choices A and E. Presynaptic voltage-gated calcium channels mediate the influx of calcium into the axon terminal, promoting vesicle fusion and neurotransmitter release into the synaptic cleft. Gabapentin is an anticonvulsant that works by blocking voltage-gated calcium channels, thereby attenuating excitatory neurotransmitter release. Choice B. Presynaptic voltage-gated sodium channels open when the cell becomes sufficiently depolarized, triggering an action potential that propagates down the axon. Phenytoin blocks presynaptic voltage-gated sodium channels and can be used to prevent recurrence of status epilepticus due to its long duration of action. However, it has a slow onset of action, and patients in status epilepticus should be given a rapid-acting benzodiazepine first. Choice D. Selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors are examples of medications that prevent presynaptic neurotransmitter reuptake. They are typically used to treat depression and anxiety disorders. Educational objective. Intravenous benzodiazepines, for example, lorazepam, are the initial drug of choice for status epilepticus. They work by enhancing the effect of gamma-aminobutyric acid GABA at the GABA-A receptor, leading to increased chloride influx and suppression of action potential firing.